Hello everyone, this is Mustafa Marayati and this is the second part of the series of arterial supply of the brain. So in this second part, we are going to talk about the anterior circulation and we will discuss the internal carotid artery. Well, if we are talking about the anterior circulation, we should think the origin of the blood from the heart, how it comes to the anterior circulation. Well, we have in the anterior circulation, two ICAs will give rise to the MCAs and the ACAs, which form the anterior circulation. So how the ICAs gets its blood from the heart, here is the origin from the aortic arch. Here we have the aortic arch. On the right side, it gives to the brachiocephalic trunk, which give rise to the right common carotid artery. And then here we have the origin of the left common carotid artery taking off the aortic arch. Now we are at the heart level, moving upward. Now we are in the neck. Here we can see a right-sided dissected neck. This is the right common carotid artery passing deep in the neck and at the level of C3, C4 vertebral level, or posteriorly or anteriorly at the level of the thyroid cartilage. The common carotid artery bifurcates into an internal carotid artery, which will run deep in the skull to supply the brain and the eye, and the external carotid artery, which will run superficial to the skull and supply the head and neck structures. Moving more up, we are at the base of the skull, reaching the carotid canal, which is situated inferior to in the petrus part of the temporal bone. This is the temporal bone, and this is the petrus part of it. And here is the carotid canal. The ICA will pass through it to go intracranially. So in the petrus part of the temporal bone, we are showing here in this figure, this is the course of the ICA. Here is the cervical segment in the neck. As it's passing through the carotid canal, it becomes the petrus segment. So this is in the skull. And then exiting through the foramen lacerum to become the cavernous segment in the cavernous sinus, and then the supraclinoid segment, which will divide and give the terminal bifurcation of the ICA, the terminal branches of the MCA and the ACA. So here one point to be given, and that in the petrus segment of the ICA changes its direction from going vertically, as in the neck, to become horizontal, to pass in the bone, and then exiting the petrus part through the foramen lacerum as it goes vertically one more time. So this change in the course, as we can visualize here, and this is the right ICA as it passing through the carotid canal and the petrus part of the temporal bone and exiting the foramen lacerum, the change in the course to become the cavernous segment over here and the supraclinoid segment. Rhoton described 4 segments for the ICA, starting from C1 to C4. C1 is called the cervical segment in the neck. C2, it's called the petrus segment as it passes in the petrus part of the temporal bone. The C3 segment, the cavernous segment. The C4 is the supraclinoid segment. And we can notice here the C4 segment has 3 segments in it. The ophthalmic segment, which gives the ophthalmic artery, the communicating segment, which gives the posterior communicating artery, and the choroidal segment, which gives the anterior choroidal artery. And then we have the terminal division of the ICA of the supraclinoid segment or the C4 segment of the ICA into a biggest branch, the middle cerebral artery, the MCA, and which goes laterally, and the smallest terminal branch, the ACA, which goes medially. There are also other classifications for the ICA. For example, Bouthillier classifies ICA into 7 segments from C1 to C7, the cervical segment, the petrus, lacerum, cavernous, clinoidal, ophthalmic, and communicating segment, respectively. And there are also other classifications for the ICA. Now, we are seeing here the base of the skull. Here is the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. Here is the petrus part of the temporal bone. And here is the foramen lacerum through which the ICA exiting the petrus part. So it's the petrus segment in here to become the cavernous segment. So here situates the cavernous sinus in which the cavernous ICA runs. And then as it passes superiorly and medially, it passes adjacent and medial to this bony process. This is the anterior clinoid process. So after passing medial to it and superior to it, it will be termed as the supraclinoid segment, which is the C4 segment of the ICA. Here is the internal carotid artery with its four segments: the C1, the cervical segment; C2, the petrus segment; C3, the cavernous segment; and the C4, the supraclinoid segment. This is a lateral view, and this is the anterior view. We mentioned that in the C4, the supraclinoid segment, it has three segments in it. The ophthalmic segment, which gives the ophthalmic artery as it goes underneath the optic nerve to go through the optic canal, here in the blue. It has very short intracranial course, so it cannot be visualized. And the second segment, the communicating segment, the yellow one over here, which gives rise to the posterior communicating artery, which will unite with the P1 segment of the posterior cerebral artery to form the P2 segment of the PCA. And that's contributing to the posterior circulation. And then we have the third segment, the more distal one, is the choroidal segment. Here in the green gives rise to the anterior choroidal artery, which will run to supply the choroidal plexus in the ventricles to supply the CSF, or to produce the CSF. And then here, the terminal division of the ICA into an MCA, which goes lateral, and this is the biggest branch, and the ACA, which goes medially, and this is the smallest terminal branch. The branches of the supraclinoid, or the C4 segment of the ICA, including the ophthalmic artery, the posterior communicating artery, anterior choroidal artery, middle and anterior cerebral arteries. So as we have visualized this diagram before, this is the course of the ICA. The segments of the ICA, as we mentioned previously, here is the cervical segment in the neck, and here then it becomes the petrus segment. Then this is the cavernous segment, and it has a little bump over here, distinguishes the cavernous segment. And the final, the C4 segment, is the supraclinoid segment. And here we have the middle cerebral artery. Here we have the anterior cerebral artery. This should be the ophthalmic artery, as it is the first branch that goes off the C4 supraclinoid segment. And here is the posterior communicating artery, and this is the anterior choroidal artery. Regarding the cerebral artery territories, that the areas to be supplied by the cerebral artery, each individual cerebral artery, the MCA, the ACA, and the PCA is shown in this figure. On the left, we have the lateral surface of the brain. In the middle, we have a medial surface of the brain. And on the right, we have the coronal section of the brain. And each area is colored by a distinguished color to visualize the artery to be supplied by. If we look in the lateral surface of the brain, we can see most of it is supplied by the green area that represents the middle cerebral artery. And if we see in this coronal section that the lateral surface of the brain is supplied by the MCA. And if we want to know the area to be supplied by the ACA, it represents the medial anterior surface of the brain. This is the medial surface of the brain, and in the yellow, and the anterior half of it is supplied by the ACA. And also there's a strip on the lateral surface of the brain that's also superiorly to the area supplied by the MCA, is also supplied by the ACA. So it supplies medial anterior surface and also strip superior and lateral aspect of the brain surface. On the coronal section, also we can see the medial surface is supplied by the ACA. Regarding the PCA, just for like for the ACA, it supplies the posterior and medial. So it also supplies the medial surface, but now it's posteriorly. And also there's a strip to be supplied on the lateral surface of the brain, also by the PCA. And that concludes the second part of the series.